at some research that has to do with looking at, I forgot what poundage of tension on a fish line, but you could use a fish line for your dermatomal assessment. All you do is look at you take the fish line, you poke it, and once it bends, that's it. The reason that's helpful, or why I appreciate that method, is because technically light touch, you can do like a tissue or something like that, but the problem with a tissue is that if you have hair, we'll say along your arms or anything like that, that if you don't get to the skin and you get to the hair, that's going to stimulate different sensory receptors. So that's why they recommend fish line, or if you have a monofilament, which you probably will learn about in when you get to like integumentary and stuff. Monofilaments are what they use. I think that's just sharp. Yeah, that's sharp. That's not a monofilament. Monofilament is literally a piece of string, not string, a piece of wire, just like fish line, that has different gauges. Man, crushing it right now. You're doing great. And you usually use it on the bottom of feet to look at the protective response for someone who's diabetic. So that's why there's different amounts. So we use the fish line to do that. For now, I don't even have a tissue, so I can't even. No, that's too much. Like if one of those would be like a monofilament.
A piece of paper?
I'll just use my hand. I just want to give you a reason of what to expect. You don't use tissue because of this reason. You use a monofilament or fish line for this reason. That's all I want you guys to be able to know. That's okay. That would be sharp. Just gives you a general idea. So at this point, remember, we're just looking at, is it the same? Is it different? We're not stroking. We are touching, and then that's it. Does this feel the same as this? Yes, no. If they say no later on, then we can look at when does it appear and disappear so that we could define our borders. Because what are we worried about when someone complains of radiculopathy? Compression, but what is their symptoms? Distal. So that's where it's helpful, because you would expect, let's say she injured C6. Maybe she has a little less here, but the rest of C6 is fine. That would be, I guess, normal or makes sense, because the distal dermatome is affected, the rest is not. If the rest of the dermatome is affected, let's say all of this is numb, not just her finger, what are we concerned about?
Entrapment?
Of what?
Peripheral
Nerve entrapment. So peripheral nerve entrapment, you're looking at possible pain, numbing, tingling, etc. along the whole dermatome. Radiculopathy, nerve root compression, you're worried about diffuse distal dermatomal paresthesias.
So is peripheral entrapment and radicular pain the same thing? What's radicular pain then?
Lancinating down the arm.
And that's inflammation.
And it doesn't have to be dermatomal specific.
Radiculopathy is the distal part.
Yes.
Yeah.
Yeah.
For nerve entrapment, is that from the segment down, or is that like?
So when he says peripheral nerve entrapment, if it's here, we're thinking like a pronator Terry syndrome, because it's the median nerve affecting. And yes, it would only be here down. It would not be here up, because then it's not peripheral nerve. Good?